All right, let's review some practice questions regarding care of the newborn. As with all of our practice question videos, I do ask that you pause the video after we initially review the question and the answer options. That way you can come to the correct answer independently, and then you can resume the video for us to review the answer and the rationale together. All right, so we have a classic multiple choice to get us started, testing your knowledge of physiological integrity. The nurse is preparing to administer a phytonadione vitamin K injection to a newborn and is providing education on its use to the mother. Which of the following would the nurse include in her teaching? So, of these options, what is the correct answer? Why do nurses administer vitamin K to newborns? Why is that important? All right, so the correct answer is because vitamin K helps to prevent bleeding disorders. So newborns are deficient in vitamin K, so the administration of phytonadione is necessary for the body to synthesize coagulation factors. So it's administered to the newborn to prevent bleeding disorders. It also promotes liver formation of clotting factors 2, 7, 9, and 10. Newborns are vitamin K deficient because the bowel does not have the bacteria necessary to synthesize fat-soluble vitamin K. So the normal flora in the intestinal tract produces vitamin K, and the bowel does not support the normal production of vitamin K until the bacteria can adequately colonize it. So the bowel becomes colonized by bacteria as food is ingested. Vitamin K does not promote the development of immunity or prevent the infant from being jaundiced. All right, a highlight in text style question testing knowledge of physiological integrity. The nurse is reviewing the health history and medical record of a 4-day-old newborn that presents to the outpatient clinic for a hospital follow-up. The nurse notes the following. The baby was born full term, no complications, 7 pounds, 3 ounces. The mother has been breastfeeding every 3 hours, and the baby has been latching without difficulty. The baby has urinated 13 times in the last 24 hours, has had 5 bowel movements in the last 24 hours, which have been a yellowish brown in color. The mom reports a darkening of the skin. The nurse notes jaundice on physical exam. Temp is 99.9, heart rate 180, respiration 70, and the weight is now 7 pounds, 4 ounces. Also, the nurse notes that the bilirubin level is 4.8. So I want you to highlight the findings that are of immediate concern to you as the nurse. So which findings are concerning right now to you as the nurse? All right, so you will come to the conclusion that this newborn is presenting with hyperbilirubemia because a normal bilirubin level is 0.2 to 1.4, and this baby's bilirubin is 4.8. It is normal for newborns to urinate usually up to 20 times a day and to have 5 to 6 bowel movements per day, depending on their feeding schedule. And then normal vital signs for a newborn. It is a temp of 97.7 to 98, so this baby's temp is elevated and therefore is of concern. A normal heart rate is 120 to 140. This baby's heart rate is 180, therefore it is highlighted, it's of concern. And a normal respiration rate is 30 to 60. This baby has a respiration rate of 70, and therefore it is of concern. Reports of darkening of the skin and then the jaundice are also evidence of that hyperbilirubemia that the patient is presenting with. All right, this is a drop-down style question. Testing knowledge of physiological integrity and your ability to compose an APGAR score based upon assessment findings, which is very important to be able to do. So the labor and delivery nurse is caring for a newborn just delivered via C-section. So your first APGAR score 1 minute after birth, the nurse notes that the newborn's arms and legs are not moving. The heart rate is 96. Also, there is no noted reflex irritability, and the respirations are absent, and the newborn appears pale in appearance. At 5 minutes for your second APGAR scoring, the newborn's arms and legs remain flaccid with minimal response to stimulation. Heart rate has increased to 115 beats per minute. The newborn's skin remains pale in color and respirations are now present, but are characterized as slow and irregular. So based upon those assessment findings, the nurse determines that the patient's APGAR scores are what and prepares for blank as the priority nursing action. All right, so definitely review APGAR scoring, know your characteristics, your assessment findings, and how to tally those up. This particular newborn is presenting with APGAR scores of 1 and 4. The highest priority on admission to the nursery for this newborn is the airway. So that's going to involve preparing respiratory resuscitation equipment and oxygen. All right, we have a drag and drop style question testing knowledge of physiological integrity. The nurse is caring for a newborn that was born vaginally but required the use of forceps during delivery. Upon initial assessment, the nurse notes visible swelling on the scalp that extends beyond the suture lines of the skull. The swelling is soft to the touch and associated with a discoloration of the skin. So the nurse determines the patient is presenting with blank and educates the newborn's mother that the condition will blank. So, is this patient presenting with cephalohematoma, caput ceccidium, or cerebral edema? So, based upon the slice of medical record that we have, what can we determine that the newborn has and is presenting with? And then what education can we provide to the mother based upon that finding? All right, so we can determine that the newborn is presenting with caput ceccidium, and we can educate the mother that this is going to self-resolve within 2 to 3 days. So caput ceccidium and cephalohematoma are both conditions that can occur in newborns during labor and delivery, and they both involve a swelling of the scalp. However, there are some key differences between the two conditions, and it's very important that you're able to recognize those differences. So caput ceccidium is a swelling that occurs on the soft tissues of the scalp. It typically crosses the suture lines of the skull. It's usually caused by pressure from the birth canal or from the use of a vacuum extractor or forceps during delivery. Caput ceccidium is often visible at birth and typically goes away on its own within a few days, up to a week after birth. Now, on the other hand, a cephalohematoma is a collection of blood that occurs between the skull and the periosteum, which is the membrane that covers the bone. So it typically does not cross the suture line, and it's often localized to one side of the head. So cephalohematoma is usually caused by trauma to the head during delivery, also from the use of forceps or vacuum extractor. It may not be visible at birth, but it can become more apparent in the days following delivery. It also usually resolves on its own. It just takes longer, usually within a few weeks to a few months after birth. All right, we have a classic matrix multiple choice style question here. So the postpartum nurse is providing education to a newborn's mother on the various infant reflexes and when they will be tested. So as always with our matrix multiple choice style questions, I want you to read these statements and determine if that statement is true or demonstrates an understanding of the teaching, or if that statement is false and indicates no understanding of the teaching provided. All right, so we have 2 correct statements, 2 inaccurate statements. So the 2 correct, the sucking reflex usually disappears after 3 to 4 months. And then the Moro reflex involves the baby spreading out the arms and crying. So the sucking and rooting reflex, it does usually disappear after 2 to 3 months of age, but it can be present for up to 1 year. The Moro reflex involves the infant spreading their arms out and crying when the loss of support is felt. So this Moro reflex is usually absent by 6 months of age. The Babinski sign or the plantar reflex will usually disappear after 1 year of age.